Hello, this is Dr. BALA'S. Today we will talk something about the feedback mechanism, which is very important in maintaining the internal equilibrium. In my last video, we saw something about the thermoregulation in which the nervous system was very much involved, and we saw how the internal temperature was maintained. The body tried to maintain the internal temperature around 37 degree or Celsius, and we saw the mechanism. Now we will see the other mechanism, which is a hormonal control of the internal equilibrium. So that internal equilibrium, we call it homeostasis. And last time we saw something about the hormonal control of blood sugar level by the hormones secreted by the pancreas, namely the glucagon and the insulin, one increasing the blood sugar, the other decreasing the blood sugar or controlling the blood sugar. So we saw in that previous videos. Now we will take another example, which is also something concerned with the endocrine system, namely hormonal control. And this system, this mechanism of maintaining the internal equilibrium by the endocrine system, we call it the feedback mechanism. In fact, it is called a feedback loop mechanism because the mechanism does not stop when a value goes down. It has to increase. When the value goes more, it has to decrease. Every minute there is a change inside the body, and depending on the change and depending on the result of the change, the body has to do some extra work to maintain the balance inside. So this is something like a loop in which the action continuous process, a dynamic process to maintain the equilibrium. What is feedback? You feed something and you ask, how is it? An answer comes, and that answer becomes the feedback for your work done. So why it is important? Based on the feedback, you will try to modify your work. For example, you take a teacher and a student. If the student is less intelligent, the teacher has to do more work. If the mark scored is less by the student, the teacher will put more effort to compensate to increase mark by the student. If the teacher works normally and the student gets a normal pass mark, then it is balanced. So if the person is intelligent, if the student is intelligent, the teacher will lessen her work. So based on the feedback from the student, the teacher modifies their work. This is a good example for a negative feedback, in the sense the student gets less mark, that is a negative. So because of this negative feedback, the teacher has to work more. Well, suppose you prepare a coffee and you ask the person, the customer, how is the coffee? The customer says it's not very good. This is a negative feedback. Now, the owner of the shop will have to improve his work or work more to give a better coffee. So this is also something equal to a negative feedback. The teacher and the boy example. The boy gets a good mark. Now what happens? The teacher wants to teach more so that he will take more marks. She starts working more and more. Here, the boy also gets a good mark, that is a positive feedback. She works again more so that the boy will get more marks. Both are in a positive side. This is a positive feedback. Now we'll see an example within our body. This I told a hormonal feedback loop mechanism. One organ which many of us are very much worried, in the sense, every time when you go to a doctor, they will say, you have checked the thyroid gland, a thyroid function test. Because thyroid is a very important organ which is involved in all the metabolism. This hormone will act on most of the organs, almost all the organs, because it's a metabolic hormone. Take this thyroid as the student. Then who is the teacher here? The pituitary is the teacher. Thyroid is under the control of pituitary. So what pituitary does? Pituitary secretes thyroid stimulating hormone, TSH. This thyroid stimulating hormone stimulates the thyroid gland, something like the teacher teaching the student. The thyroid gland starts secreting its hormones because it is stimulated by the pituitary. So pituitary is the center and thyroid is the target organ. If pituitary stimulates the thyroid more and more thyroid hormones will be secreted. If the pituitary reduces its stimulus, the thyroid gland will reduce its secretion. Here, depending upon the performance of the thyroid gland, that means depending upon the or thyroid hormones in the blood, the pituitary will either stimulate more or stop stimulating this. At the same time, if the thyroid hormone level is less, that means the thyroid gland is not working properly. Now the pituitary will stimulate more by secreting the stimulating hormone, that is TSH. So from this situation, what you know, if you test the thyroid hormone level in the blood and if you test the thyroid stimulating hormone in the blood, if the thyroxine level is less, the thyroid stimulating hormone will be more because the thyroid gland is not working properly. So the boss pituitary has to stimulate more by secreting thyroid stimulating hormone TSH. So now if you test the blood, if the thyroid hormones are less, definitely the thyroid stimulating hormones will be more. Because the thyroxine level or thyroid hormone level is less, this is called hypothyroidism. If you test only the thyroid stimulating hormone, TSH, if that level is within normal limits, that means the pituitary secretes normal level of TSH or thyroid stimulating hormone because the thyroid hormone level in the blood is normal. So both are normal. Think another situation in which the thyroid is secreting more hormone than normal. Then the pituitary will reduce the secretion of TSH or thyroid stimulating hormone. That means, so now if you check the blood, the thyroid hormone level will be more because it is more in the blood. The stimulation by the pituitary is reduced, so automatically TSH level will be less. So forget about the thyroid gland. You take only now the TSH, thyroid stimulating hormone. If you check the thyroid stimulating hormone, if that level is more than normal, that means the thyroxine level will be less. In hypothyroidism, what will happen? The blood thyroid hormone level will be less, but the thyroid stimulating hormone will be more. The next scenario, if you take thyroid hormone level, if it is very high, then the thyroid stimulating hormone level will be less. So depending upon the performance of the target gland, namely the thyroid gland, the pituitary gland will modify its work. If the thyroid gland works less, the pituitary will work more, like the teacher and the student. If the thyroid gland is secreting normal level, the TSH will be normal in the sense that pituitary also will work normally. If the thyroid gland secretes more hormones, this extra hormone in the blood, the pituitary will stop stimulating the thyroid gland. When it stops stimulating, the stimulating hormone level will be less. That means TSH will be less. So if the thyroid hormone level is less, the thyroid stimulating hormone will be more. Low thyroid hormone level is called hypothyroidism. High level of thyroid hormones is called hyperthyroidism. This is a very good example for feedback mechanism. So depending upon the blood thyroid hormone level, the pituitary will work. So this is called a negative feedback mechanism. Next, positive feedback. What is that positive feedback? Teacher works, the boy also works. The boy gets more and more. Again, teacher starts working more and more to make the boy get more and more. So this is an example for positive feedback. If you come to the body, a very good example for positive feedback is labor, delivery, or parturition. What should happen? The child should come out of the uterus. For that, the orifice, the opening through which the child comes out, should dilate and the uterus has to contract. Fine? Right. So how? This is an example for a positive feedback. The fetus travels down because the uterus is contracting. Now, the orifice, the cervix, through which the fetus comes out. Now the cervix is stretched. So this stretching of cervix sends an impulse to the brain. The contraction of the uterus is done by a hormone called oxytocin. This is a hormone from the posterior pituitary. When the cervical opening through which the fetus has to come out, when it is stretched, these stretch receptors which are present in that, they send an impulse to the posterior pituitary. Now the posterior pituitary sends the oxytocin. This oxytocin will increase the contraction. When the contraction is increased, the stretched receptors are again stretched more. This is a positive effect. When the stretched receptors are stretched more impulse goes to the posterior pituitary. Again, oxytocin is released. So here, the contraction is a positive reflex or positive phenomena, and the quantity of oxytocin is increasing in the blood to make the uterus contract more and more. So more contraction stimulates the posterior pituitary to secrete more oxytocin. So here two things, both are positive. So this is a very good example for positive feedback mechanism. So we have seen two mechanisms. One is the thyroid pituitary axis, and next is the uterus, the stretch receptors, and the hormone oxytocin level. So both are hormones, but both act on the basis of feedback mechanism or feedback loop. So these two examples show how a feedback loop mechanism works inside our body. This is something like an orchestra. The endocrines, they play a role like an orchestra. Thank you. So in my next video, we will talk something about the hemopoietic system, the blood, its formation. In that, we will talk about blood, its volume, its components, its functions, etc. To start with, we will talk something about the quantity of blood everyone has. That is the blood volume and its variations, how the volume is maintained. All these things we will see in the next video. Thank you.